Imagine you're sitting in a clinic.
Right.
You're watching a phlebotomist draw your blood for this cutting-edge regenerative therapy.
Yeah, you're probably expecting to see that deep, healthy crimson color fill the tube.
Exactly. But instead, the vial fills up with this thick, opaque liquid that honestly looks exactly like a strawberry milkshake.
Which is incredibly visually shocking.
Right. And it's not just a cosmetic thing. This is a physiological reality of metabolic health that is quietly sabotaging platelet-rich plasma therapies all over the world. So, welcome to today's deep dive. Our mission today is to unpack exactly what happens to your PRP when the blood being used is swimming in excess cholesterol or lipids.
Right, a condition clinically known as lipemia or chylomicronaemia.
Yeah. And to set the stage here, PRP, or platelet-rich plasma, relies entirely on drawing your own blood, spinning it down to isolate the platelets, and injecting them back in.
Which sounds great in theory.
Right. But what if your systemic metabolic health, like high fat or cholesterol levels, completely interferes with that process?
Well, we've got a really dense stack of sources today to figure that out. We're looking at clinical trial consent forms, visual inspection guides for blood components, and some heavy biochemical research on platelet function.
It's a lot to get through.
It is, yeah. But the goal is to emphasize that we aren't just looking at the color of the plasma. We're exploring how systemic lipids physically alter blood viscosity, disrupt clinical centrifugation, and honestly, fundamentally redesign the outer membrane of your platelets.
Okay, let's unpack this, starting with the visual impact.
Right,
The strawberry milkshake effect.
right, yeah, the aesthetic shock factor.
Yeah. Looking at this blood component visual inspection guide, they note that lipemic whole blood literally looks milky. And when you isolate the plasma, instead of being that normal, clear, light yellow liquid,
Which is what you want to see.
right, it looks opaque, almost like melted butter.
Yeah.
So scientifically, using the Biochemia Medica source, why does this actually happen?
Well, it's not just any fat causing this, it's specifically the accumulation of the largest lipoprotein particles. They're called chylomicrons.
Okay, chylomicrons.
Yeah, and they range from about 70 to 1,000 nanometers in diameter. What's really interesting is that high levels of the smaller particles, like HDL or LDL, don't actually cause the blood to become turbid or cloudy.
Wait, really? Because millions of people have high LDL cholesterol.
Exactly, but their blood doesn't look like a milkshake. Those particles are just physically too small to scatter light in a way that makes the fluid opaque.
So if my bloodstream is a swimming pool, the LDL and HDL particles are like golf balls scattered around.
I like that analogy.
The water still looks clear.
Yeah.
You see right through to the bottom. But the chylomicrons, because they're so big, they're like thousands of giant, opaque beach balls.
Right, thousands of them.
And they completely block you from seeing the bottom of the pool.
That is exactly what happens. The physical mass of those chylomicrons scatters the light.
But does this cloudiness actually matter? I mean, is it just an aesthetic issue for the phlebotomist, or does it ruin the treatment?
Oh, it matters immensely. Now, Canadian Blood Services notes that lipemia doesn't inherently compromise the safety of a standard blood transfusion.
Okay, so if you're just moving blood into a trauma patient, it's fine.
Right, it's perfectly safe. But in the context of PRP, this turbidity wreaks absolute havoc on laboratory testing.
How so?
Well, clinics use optical tests, like spectrophotometry, to accurately count the platelets. They need to know they have a therapeutic concentration before they inject it.
Because if there aren't enough platelets, a PRP won't actually do anything.
Exactly. But a spectrophotometer relies on transmitting light through the sample. When the plasma is milky and packed with these giant chylomicrons, light can't pass through.
Oh, wow. So the test is just completely ruined.
Yeah, the machine is basically blinded by the fat in the plasma.
That's wild.
Yeah.
So because the blood is now thick with these giant beach balls, we have to ask how this physical change impacts the actual mechanical process of creating PRP.
Right, the centrifugation hurdle, fighting the viscosity of the fluid.
Yeah, let's dive into the mechanics of spinning blood.
So the whole process of separating platelets relies on a physics concept called Stokes' law,
Okay.
which basically dictates how particles settle in a fluid based on gravitational density variance or specific gravity.
And platelets have a specific gravity.
They do, yeah. Platelets naturally sit between 1.047 and 1.080 grams per milliliter.
So under normal circumstances, you spin the blood and the platelets migrate perfectly into this little layer.
Right, the Buffy coat. But that assumes the fluid has a normal, predictable viscosity.
Which brings us to the study on hypercholesterolemia. It reveals that high plasma cholesterol directly, physically, alters blood viscosity.
It makes it significantly thicker.
Yeah. So the standard centrifuge settings, like, say, spinning at 800 RPM for a bit, then doing a harder spin at 2000 RPM, those might fail to yield optimal platelet levels because the blood is just too thick.
They absolutely can fail, yes. The drag force in the fluid is just too high.
There's actually a fascinating real-world source on this. It's an informed consent form for a clinical trial in China.
Oh, the hair loss trial, right.
Yeah, they were using PRP to treat androgenetic alopecia. And the consent form explicitly warns patients that if they have, quote, lipemic or fatty blood, the collected PRP might fail to reach a therapeutic concentration.
Or it might contain too many other cellular components. Yeah.
Right, rendering the whole batch unusable and requiring a repeat collection.
Which is a huge hassle for the patient and the clinic.
Totally. So if the blood is too viscous from fats, it's like trying to spin a handful of marbles out of a jar of honey instead of a jar of water.
That's a perfect way to visualize the drag force. The marbles just won't sink in the honey.
Right. So if a standard centrifuge protocol doesn't work for hypercholesterolemia, how is a clinic supposed to adapt? Do they just guess the speed?
This raises an important question, honestly. It's a major blind spot in current regenerative medicine.
I mean, how could it not be?
Right, because a standardized protocol with fixed time and speed yields completely different PRP profiles depending on your baseline hematologic traits.
Like your lipid levels or your hematocrit.
Exactly. The whole one-size-fits-all centrifuge setting is deeply flawed when you're dealing with lipemic blood. The machine doesn't know the blood is thick.
So we know fatty blood is visually cloudy. We know it's physically harder to process. But let's say the clinic actually manages to successfully isolate the platelets from this viscous blood.
Let's assume they nail the spin cycle, yeah.
Are the platelets themselves still effective? Or does the high cholesterol actually change how they function inside the body?
This is where we run into the acute versus chronic paradox in the research.
Right, because there was a surprising contradiction in the sources. One study showed that feeding healthy participants a massive high-fat meal, like almost 56 grams of fat, turned their plasma grossly lipemic.
It looked like a milkshake.
Yeah, but it did not negatively affect their platelet aggregation, which is their clotting function.
Yeah, they still function normally in an acute setting.
In fact, another source noted that a high-fat meal can actually temporarily increase peripheral platelet concentration compared to fasting.
Yeah, the body's pretty good at handling a sudden, acute influx of dietary fat.
But chronic danger is a whole different beast.
Exactly. If you look at the parenteral nutrition and aging sources, chronic exposure to lipid emulsions fundamentally alters the plasma membrane of the platelets themselves.
The outer shell of the platelet.
Right. A platelet's membrane is made of phospholipids, and over time, chronic high cholesterol changes the ratio of cholesterol to phospholipids in that cell membrane.
Which changes its flexibility.
Yes, it fundamentally alters the membrane's fluidity. And that fluidity change directly impacts the receptors on the outside of the platelet.
Here's where it gets really interesting. So eating a burger right before a blood draw might make your plasma cloudy.
Yeah, you'll fail the optical test.
And it might spike your platelet count, but it doesn't break their function. But chronic high cholesterol is like permanently replacing the flexible rubber tires on your car with rigid wooden wheels.
Oh, that's a great analogy.
Right. The platelet's outer shell is redesigned, making it overly sensitive and hyperactive.
I completely agree. The research shows that aging and chronic cholesterol exposure shift the platelets into a hyperactive prothrombotic state.
Meaning they want to clot too easily.
Exactly. And there was a really telling study showing that patients with hypercholesterolemia taking statins, like a simvastatin,
Which millions of people take.
right, they didn't see an influence on their platelet function in vivo, meaning the medication isn't necessarily undoing this altered platelet behavior. The cholesterol numbers drop, but the wooden wheels are still there.
Wait, really? The statin doesn't fix the platelet membrane?
Not according to this data, no. It lowers systemic production, but the structural damage to the circulating platelets remains.
That is genuinely concerning.
It is. If we connect this to the bigger picture, this means that when we inject this PRP into a patient for tissue healing, the platelets might not release their growth factors in the precise, controlled way we need.
Because their membrane fluidity and receptor sensitivity have been totally compromised by systemic cholesterol.
Exactly. They might dump all their growth factors at once, or misfire entirely, which won't help regenerate that knee tendon or regrow that hair.
Wow. So to summarize this deep dive for you, elevated systemic lipids, whether from a recent heavy meal or chronic hypercholesterolemia, turn your plasma into this cloudy, milky substance.
Right, the strawberry milkshake effect.
Yeah, which disrupts optical testing. It exponentially increases viscosity to the point of ruining standard centrifuge protocols, and over time, it literally alters the cellular membrane of your platelets.
It's a complete mechanical and biological disruption, and it leaves you with a final thought to really ponder.
Yeah, what's the big takeaway here?
Well, we tend to view regenerative medicine, like PRP, as a magic bullet, using our body's own natural tools to heal itself.
Right, it's your own blood, so it must be perfect.
But if your systemic metabolism is compromised, your natural tools are compromised too. It really makes you wonder, as regenerative medicine advances, will we reach a point where clinics require patients to undergo a metabolic detox?
Oh, wow. Like a prerequisite.
Exactly. Like, will you have to adhere to a strict systemic diet for months before you are even allowed to use your own blood as a therapy?
It is wild to think about, but it
Hmm.
makes complete sense. So what does this all mean? It means your baseline health dictates your regenerative potential. Thanks for joining us on this deep dive.